All right, if you have good teeth, you probably take biting into an apple or corn on the cob for granted. Imagine, though, if you couldn't do that, if you had dentures or were missing teeth for one reason or another. There's a procedure that can help. Mini dental implants. Joining us now is Dr. Paresh Patel to tell us more about it. Dr. Patel, thank you for joining us today.
Well, thank you for inviting me. I appreciate being here.
We're glad you're here. I mentioned mini dental implants. Can you tell us what's the difference between a mini dental implant and then a traditional dental implant?
Sure. Well, there are some similarities between the two, as we can use either style of implant to replace missing teeth in the upper or lower jaw. Over the years of placing a traditional style implant, I would have to make an incision, a cut in the gum, push the gum back to get to the jawbone, and then use a drill similar to what you're showing right there, a large drill to make a hole in the bone to place the implant. I would then cover that implant back up with the gum and let it heal for 4 to 6 months. The problem I had with this kind of implant was that most of my patients would not have enough volume of bone, so I'd have to do another surgical procedure to make the bone ready for the implant. Maybe a bone graft, maybe a bone expansion in the upper jaw, maybe a sinus lift. So then we decided, how about talking about something that's smaller, a mini dental implant. So now I can use a smaller drill like the one you're showing right there.
It's a big difference.
It's a big difference. It's about the size of a pencil lead. So I can make a small pinpoint hole in the gum now and a small hole in the very outermost layer of the bone, and I can gently rotate a mini dental implant into the jawbone. Because it actually condenses, compresses the bone, we can use that implant almost immediately. So what used to take 4 to 6 months worth of time to heal now takes about 4 to 6 weeks.
Well, that's so much better for patients, don't you think, and for you too?
Absolutely.
Oh my gosh, that's so much better. That's remarkable. Who needs this? Who's a candidate for this?
Maybe just about anybody who's missing a tooth. Maybe you're missing a front tooth. Maybe you have a one-tooth partial denture. We can place a mini implant, ask the laboratory to make us a porcelain crown. We can then put the porcelain crown on top of it. Maybe you got a partial that has several teeth that are missing on it. We can put several mini dental implants in place, put a bridge over the top of that. The patient doesn't have to remove that. It's kept clean by brushing and flossing just like a regular set of teeth.
Well, how pretty is that? Nice little teeth there, looking good.
The other thing that we can do is that a lot of my patients have complete dentures. We'll put 4 mini implants in place, put the snaps in on the inside of the denture. We fit that all in about an hour. It's secure. The patients now have a set of teeth they can function off of. Most of the time with upper dentures, patients complain of the roof of the mouth not being able to let their taste their food. We can put in maybe 6 implants in on the top, fit the snaps in on the side of it. Now we can have an upper denture that stays put. It doesn't have the palate anymore. They can talk, they can taste their food, and they don't have to worry about things falling out maybe at an unopportune time.
Oh, yes, that would be unfortunate. No one wants that to happen. What a difference. It's just amazing to me what you can do now with dentistry. I mean, you really can fix everything. Tell us about some of your successes with patients as we take a look at some before and after pictures.
Sure.
Wow, that's remarkable.
And this is one of our young patients. He had just gotten done with some orthodontic treatment. He was missing his laterals, the 2 little teeth on either side of his front teeth, a real common condition. Didn't want to have to wear a retainer with 2 fake denture teeth on it. Just wanted to be a normal kid. So we were able to put 2 mini implants in place, make 2 porcelain crowns. That was done about 3 years ago, and he's been wearing it ever since. And here's another patient of ours. She was missing her 2 front teeth, had a partial, never felt comfortable, and she had 2 mini implants placed and 2 front teeth crowns placed on top of it.
Looks beautiful. Nice work,
Well,
Dr. Patel. That must feel really good, though. It's very rewarding, I think, to see the difference, and for patients, because people who have issues with their teeth, I always notice they don't want to smile.
That's correct.
And it really can improve just how you feel about yourself.